Doc on the Run. We help injured runners run.
Nobody calls me because they're about to get injured. People don't ask me to come to their homes. People don't call me for webcam visits. People don't call me for phone consultations because they think they're about to get injured. But if you understand the signs that are probably indicating you are going to get a running injury, you would be a lot better served, because then you wouldn't have to talk to me, you wouldn't need my help, and you wouldn't have to go see a doctor, and you wouldn't have to stop running because you got injured. But there are a few things that you can pay attention to that often signal the possibility of an injury that's coming on. Now, if you think about an overtraining injury, what happens? It's too much stress applied to one structure over too short of a time without enough recovery to actually let it fully heal before the next workout. Now, this usually comes in a high volume period. Most people who call me because they're injured, it's about 4 to 6 weeks before their big event. For a month and a half before an Ironman race, about a month or so before a marathon. It's usually in this window when you have what? Your biggest, hardest training sessions. I mean, you're doing a progression, right? You're ramping up mileage, you're ramping up fitness, you're ramping up strength, you're dropping back down to recover a little bit, and then you do it again, and you keep ramping up further and further and further through your progression of your training, and you're beating up the tissues, but you're letting them recover. If all is going according to plan, you don't ever push too far. But if something happens, you get sick, you miss a workout, and then you kind of panic and you stack 2 workouts together, then you might exceed your body's capacity to heal and recover before the next workout, and you get an overtraining injury. But there are some things that are pretty clear signals of overtraining that I have seen over the years, over and over, in athletes who have gotten injured. And they'll often retrospectively notice it. So I start talking to them, I'll say, well, what did you notice? And they'll say they felt exhausted. So there are lots of things that happen, and feeling exhausted is one of them, or feeling brain fog. They feel like they're just hammered, they're just beat, they can't concentrate, they're really worn out. They're still motivated, they're still training hard, but they notice that at work, it's a little bit harder to stay on task. And that's just exhaustion that's coming in. And when you get exhausted, you're depleted. If you're depleted and you're having a hard time focusing mentally, if emotionally things are getting more difficult for you, that all follows physically as well. So if you're noticing some brain fog, if you feel like you're worn out and you're exhausted, you really need to look at your volume and see, is there something you can do to recover quickly, like sleep better, more actively recover, change something in your diet or whatever. But you need to talk to your coach if you're noticing that, to make sure that you're not really heading for an overtraining injury, because that stuff usually precedes an overtraining injury. The other thing is sleep disturbances. You've probably noticed this. If you do a marathon or an Ironman race or an ultra marathon, some really arduous, long, high volume, all day event that you really push hard through, it's often it's kind of like torture, but it's very, very difficult to sleep that night. So for the longest time, I've done lots of Ironman races. I've done 15 of them, but without exception, every time I've done an Ironman race, you would think that you would get back to the hotel or get home and sleep like a baby because you're so exhausted. But you have so much tissue damage and inflammation that it's actually very, very difficult to sleep. So I can almost never sleep after an Ironman race. My normal routine after an Ironman race is that, I would eat well, I would try to hydrate as much as possible, all that sort of stuff. But then I would have a terrible night's sleep. I would usually, on average, I think I wake up about once every hour after an Ironman race. So it is a little bit like torture because I feel so tired and so exhausted, and then just wake up with all these, the sort of burning sensation in my quads and this achiness all over. And then I just look at the clock and I can't believe it's only another hour since the last time I woke up. When you have sleep disturbances and you're in training, this is a bad sign. This means you have lots of inflammation, lots of tissue damage, lots of stress in your body that could lead to an overtraining injury. So if you notice any sleep disturbances, they could be signaling an impending overtraining injury. And if you have that, you definitely need to talk to your coach about it. The other thing that's also a pretty clear indicator is an increased resting heart rate. So if you monitor your heart rate and you notice that, you're tracking your heart rate and it's, let's say your normal heart rate when you're running is 135 and it's like 140. Or if it's normally 150 and it's suddenly 160 on your long runs or your tempo runs or whatever it is, the faster you're running, the higher it's going to be. So speed work, obviously it's going to be a whole lot higher than on your long runs. But if you notice that your your resting heart rate or your normal heart rate for that given run is getting higher, that's a bad sign. And you have to really, most people probably not even going to listen to this. Most people are not even going to pay attention to the things that will prevent an injury. People don't seem to want vitamins, but they sure want aspirin when their foot hurts and they need to do a race. That's why people call me. Nobody calls me because they want to make sure they're going to be okay and they're not going to get an injury in the future. They call me when they're panicked because they got an injury. So if you're listening to this and you know that you're having some sleep disturbances, you know that you're increasing your heart rate is without explanation, your heart rate is kind of creeping upward, when truthfully, if you're training more and you're getting more fit, your heart rate should be going down over time, not up. You got to talk to your coach. You got to really evaluate, are you really at risk of an injury that's going to be coming in? Because an overtrained injury, worse than anything else you're going to do in your training plan, is going to disrupt your capacity to achieve your goal race. That's the last thing you need. So I know most people will panic when their coach says, we're going to give you an extra rest day. That extra rest day might clear out the brain fog, get your sleep back on track, get your heart rate back down, and help you prevent an overtraining injury.
Doc on the Run. We help injured runners run.